everybody. Today we're going to talk about functional neurological symptom disorder, sometimes called conversion disorder. I want to explain what's happening to a person who's experiencing this and what you can do about it if you recognize yourself or somebody that you love as potentially having functional neurological symptom disorder. So the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, known as the DSM-V, has 4 criteria that a person needs to meet to be given this diagnosis. So criteria A states that they have to be experiencing altered motor function or altered sensory function. So some examples of altered motor function could be things like body weakness, paralysis, tremors, repetitive twisting or abnormal body positions. The person's way of walking could become abnormal. Some altered sensory functions are either changes, reductions, or complete loss of sensory experience. And that could be like skin sensation, for example, hearing, or vision impairment, shaking in either the arms or legs, with either a partial loss of consciousness or complete loss of consciousness, so that it looks very similar to an epileptic seizure, but it's not. Criteria B indicates that the changes can't be explained by a neurological disease. So there's no medical condition, no neurological condition to explain the symptoms the person is having. So criteria C requires the clinician to rule out all other medical conditions or mental health conditions before landing on this diagnosis. And this is where it can get really frustrating and frankly terrifying for the person going through this, because they go to a neurologist. The neurologist puts them through all kinds of tests. They're waiting to find out what these tests reveal. Do I have a neurological disease? What is going on? They get the results. There's nothing abnormal showing up, but they still don't have an answer. And test after test after test, eventually, sometimes the neurologist will say something quite insensitive, like, this is all psychological. Go see a psychiatrist. So the person goes to see a psychiatrist, and they're looking for a mental health diagnosis that they can't seem to find. And they send them back to the neurologist and say, I don't know what to tell you. This is definitely neurological. And so you can see how the person starts to get bounced around as the clinicians all try and meet this criteria or don't necessarily know anything about functional neurological symptom disorder. Meanwhile, the people around the person going through this start to question, a lot of times, is the person faking it? And so it's really important to understand that with functional neurological symptom disorder, the person isn't faking it. The symptoms are real. Criteria D requires that the symptoms be causing clinically significant distress, which for somebody going through this is usually the case because, again, the symptoms can occur out of the blue or they can be triggered by stress, but they can happen anywhere, anytime. You could be at work or hanging out with your friends or on a date, and all of a sudden the symptoms start happening. Like I said, I don't personally work in this area, but I have done a lot of research and I follow the work of Dr. John Stone, who's a neurologist and an expert on the topic. I really like the way he conceptualizes FNSD. He says, think about your computer. FNSD is like a software problem in the nervous system, whereas a structural disorder like MS, for example, is more of a hardware problem in the nervous system. So with your computer, what would you do? If it's a hardware problem, you rip the computer apart, see what the problem is, and fix it if you can. But when it's a software problem, you don't take the computer apart, you reprogram it. And so you can think about all of our thoughts, emotions, sensations, and behaviors as being like software programming that needs to be rebooted. This is really good news because what it means is that unlike a structural disorder, the brain and the body part themselves aren't damaged. And so there's hope that the functional problem is reversible. We don't really know why the functional problem occurs because, again, it's not something you can see on a scan. But what we do know is that depending on the symptoms, it seems to be either the brain struggling to receive information from the body or the other way around. I want to show you some information I got from NeuroSymptomsorg, which is the most credible and amazing website I've found on functional neurological symptom disorder. NeuroSymptomsorg shows predisposing factors, things like genetics, a structural disease, certain personality traits, as well as depression, anxiety, and adverse experiences, let's say a trauma. Then there are precipitating factors. So, for example, physical injury or illness, acute dissociation, so like losing touch with your surroundings and reality, concern and attention for body symptoms in general, and a major stressful life event that occurs. Finally, there are perpetuating factors, the changes in the nervous system function, subtle neuroendocrine changes. Worry about or trying to avoid the symptoms can have a similar effect to if you're feeling really anxious and then you try not to feel anxious about what you're anxious about. It kind of exacerbates the whole experience. And then, of course, the role that emotion plays in the functioning of the endocrine system. So things like depression, anger, frustration, the stigma associated with an undiagnosed disorder, and just not being believed in general, or the repercussions in areas of your life, such as a loss of job or income. First thing I'd say is don't stop at a non-diagnosis. If you go to a clinician and all they do is tell you about the disorders that you don't have, but they can't seem to offer you any guidance, then go see somebody else. Keep going to different people until you can put together a multidisciplinary team who can help you. Now, that team may look different depending on the symptoms that are occurring, but it could include a neurologist, a physiologist, an occupational therapist, a psychiatrist, and a mental health counselor. And the psychiatrist can help you consider the potential use of pharmacology for dealing with some of the symptoms, even if there is an absence of something like anxiety or depression. And a mental health therapist can help you with that reprogramming part, looking at all of the thoughts, emotions, sensations, and behaviors that can be perpetuating some of the motor or sensory functional symptoms that you are experiencing. Also, if you do have a history of trauma and that is playing a role in some of the symptoms you're having, a therapist can help you effectively work through that trauma. If you liked this video, please like it if you like it, and hit the subscribe button to see more videos from me in the future. If you have any questions or comments, leave them below. I would love to hear your personal story or what you know about this topic. Thanks for joining me and sticking it out to the end.